I've been needing to make this video for a while, a update on our daughter Megan's health. I'm going to try to cover everything I can in this video. Last time I talked about this on this channel was at the end of January. So I'm going to start off just by saying that Megan is doing very well. For some people who have been following Megan's story, perhaps on Facebook or through other means of communication, I just want people to know that Megan's last surgery went very, very well. She has recovered well from it. So right now, there is no more tumor. The tumor's gone. The chemotherapy, just to give a brief recap, the chemotherapy eliminated the malignancy, was completely effective, eliminated the malignancy, but this was a kind of tumor that would not completely disappear with chemotherapy only, and the surgery was needed. There were 2 surgeries. Both went well. They were difficult, very long procedures, but the doctors did the most amazing job, amazing planning, and it was completely successful, and the tumor is gone. And I can't express, how thankful we are to be able to say that. This is a long way that we've come since that last video I made back in January. It's a long way that we've come. In fact, at so many stages, I thought about making a video update, but there was just always something. We want to see what happens next, I always wanted to be able to make a report at a good time, and this is a very good time. So many things have happened, so many things have gone well, and the surgeries are behind us, the chemotherapy is behind us, and that tumor is behind us. It's gone. And now to talk a little bit about the surgeries before I back up and talk about all that Megan's been through since January. The first surgery was at the beginning of June. It went through the nose and the sinuses into where the area where the tumor was, this region called the suprasellar, kind of underneath the brain, around the optic nerves, between 2 arteries that bring blood supply to the brain. That's where the tumor was. And the first surgery going that way removed, I think the neurosurgeon said 70 to 80% of the tumor. But he didn't think he'd be able to get all of it. In fact, he knew he wouldn't be able to get all of it. But that was a long surgery, long time waiting for news. That was a very, very long day for us. Megan was under anesthesia for, it must have been 14 hours or more, maybe. Probably about 14 hours that she was under anesthesia, and we were waiting for news all day long before the doctors were able to come out of the operating room and explain to us what had happened, and it was good news. Megan had a long recovery period after that. It was a long, tough surgery with a long, tough recovery period, and she recovered. Of course, or I wouldn't be saying that everything went well. She recovered, and then there was preparation for the next surgery. After they saw exactly how things were after the first surgery, the next surgery was planned. It was another long, tough surgery, and we are so thankful to the surgeons, the ENT surgeon who worked on that first surgery along with the neurosurgeon, and then the neurosurgeon who performed the second surgery also. They showed just such dedication and such skill, and we're so glad that people like that have devoted their lives to learning and putting into practice those kinds of skills. And they're very impressive people, and the world is really a lot of the good in the world is due to these kinds of people, and the way the world is improving, getting better, very much due to doctors. We're very thankful for them, and the ones who have shown such kindness and dedication toward Megan's care. The second surgery, they had to remove an artery from Megan's brain, because the tumor was encasing that artery, which was why they didn't remove the entire tumor with the first surgery. So the doctor came up with his plan, the neurosurgeon came up with his plan, where they would block off that artery and remove it and the tumor. That way they could guarantee that the entire tumor would be removed, that there'd be nothing left that could ever cause problems ever again. And he explained that this was important because the kind of tumor that was left, even though it was no longer malignant after the chemotherapy, the kind of tumor called a teratoma, which is not a malignant tumor, meaning it does not grow rapidly, it does not spread through the body, but it is still dangerous, and it does still grow. And he said, well maybe if we left something there, it would have to be monitored. And what if it did something unexpected? What if it grew in a place that made it more dangerous? In between monitorings, in between scans, he said, really, what we need to do is make sure this tumor is completely gone. And so that's what happened, and that second surgery was also successful. It ended up being 3 different procedures. The first procedure was to close that artery. They had done a test before to make sure that Megan would respond well to that. And so that first procedure then was to close the artery. That artery was no longer supplying blood to Megan's brain. The other arteries took over. And then the next procedure the next day was the surgery itself. The surgery, it was like I think it was a 10-hour surgery, quite an ordeal. And then when that surgery was done, we were of course kind of used to it from the first surgery, but still a very long day waiting for news. And we were so thankful to hear the news at the end of that long day that yes, the surgery went well, it was successful. But when they did an MRI scan after the surgery, they saw there was still what looked like a small amount of tumor left on a major optic nerve. And the neurosurgeon decided that no, he needed to go back in and see what he could do about that. He thought, see if it could be removed. If it couldn't be removed without damaging the optic nerve, he said they would probably they would have to leave it there, because it would be a tiny bit of tumor not connected to any blood supply, and we might have just had to take that risk and leave it there. But he said, after all that we had been through, all that Megan had been through with this treatment and all the planning and everything, he wasn't going to leave it at that. He was going to go back in and see what could be done. So the next day, now, what I'm going to call the third procedure in this second operation, he went back in and he was able to remove everything off of that optic nerve. Took it off the optic nerve without damaging the optic nerve. We were very impressed and very thankful that, so by the time it was all over, no more tumor, zero, completely removed, a gross total resection, the term for that. The entirety of the tumor had been removed. It was gone. And Megan has now been home about 8-9 days. I think Megan has been home. Her recovery is great. The right eye, that is the side that the operation was on this time. The left eye and left optic nerves were not involved in this second operation. That was on the right side, and her right side optic nerves were certainly involved. But no, her recovery in every way has been very, very good. Her the swelling, which was quite pronounced at first, quickly went down, went away. She is using her eye quite well. It's just everything's going very, very well. And we are very thankful to be where we are right now. So okay, I'm going to go back a little bit now to where I left off back at the end of January when Megan was still in the hospital. She had just started chemotherapy. So 6 rounds of chemotherapy is what she went through, where they use 3 different chemotherapy drugs, ifosfamide, etoposide, and then a platinum-based chemotherapy drug. I think it was cisplatin. It was either cisplatin or carboplatin. I don't have that paper anymore that was talking about the different drugs, so I don't remember exactly. When you look up the treatment standard for these kinds of tumors, it's those 3 drugs: the ifosfamide, etoposide, and then a platinum-based drug. So it was 6 rounds of chemotherapy. Rounds 1, 3, and 5 were each 3 nights, 3 doses over 3 days, 1 dose each day. That made up 1 round. And then rounds 2, 4, and 6 were 5-dose rounds, which were considerably tougher, because of the drugs they used in those rounds. And the length of the treatment, 5 doses instead of 3, and then a drug that was more difficult to handle. Almost all of those were given inpatient, where Megan was checked into the hospital and was given a dose every day for the duration of that round of chemotherapy, either 3 or 5 nights, and then came home. For the fifth round of 3 doses, Megan was in good enough health and that she was able to do it outpatient, just there for the chemotherapy and then back home each time. But yeah, all the other 5 rounds were done inpatient, where she went and stayed in the hospital several nights. And, after each round, it was tough. It was like, knock her health down, but she would, recover from it. There was a lot of blood tests, checking on her how her blood was doing, her immune system. There were medications she took to help with that, shots that kept her white blood cell count up. It was a tough thing to go through chemotherapy. It was tough. She did occasionally need additional care besides the chemotherapy. She had fevers sometimes, and she had to go to the emergency room. It was a challenging time to go through for her and for all of us. But after each round, she would recover and kind of get back to normal, and then she'd have to go through another round and recover, get back to normal, go through another round. By the end, the last round, that last 5-dose round, was the toughest, and it was the toughest on her while she was getting the treatment, and then quite tough. Took a while to recover from it afterwards. She actually ended up being hospitalized again shortly after she came home from that 5th round. She had to go back because of fever and nausea, and she spent a couple nights in the hospital before she came home again, and then just went on the up and up. So we were just so thankful that it worked. That's just the most important thing in the world when you're going through something like that, to find out that it's working and to see that it's working. And the symptoms that were associated with that tumor at first, those symptoms all went away. The headaches went away. The different chemical markers in her blood that showed this kind of tumor, they went away. Just Megan's general health just kept getting better and better and better as the negative effects of that tumor were taken away, as that tumor was being reduced. The malignancies were disappearing because of the chemotherapy. The headaches gone. Megan's vision started to come back, which was just amazing. We were so thankful because we didn't know what exactly to expect from that. The doctors weren't able to tell us exactly this is what's going to happen. But it did happen. Megan's vision came back. The use of her eyes came back. She could open her eyes, move them around. The vision improved because everything just started healing in there. The pressure was coming off, and things started getting back to the way they were supposed to be. And we were just so thankful to see that her eyes recovered, and that showed the doctors and us that the chemotherapy was working. It was after the third round. It was in March when Megan started opening her right eye, which had been shut all that time. She started opening it, and over time, over the next days and weeks, the movement in that eye came back, so she had the use of both her eyes again. Also around that time, around halfway through the chemotherapy, we got better results on the diagnosis of the tumor. The original diagnosis that it was a mixed germ cell tumor turned out to be a good diagnosis. The oncologist chose the right treatment to go with. It turns out it was another kind of tumor called a teratoma with a malignant transformation. So to explain a little bit about this, these are all germ cell tumors. Germ cell tumor coming from germ cells, which are very primitive cells. Now, usually a malignancy from a germ cell tumor is what's called a germinoma. It's a malignancy made up of germ cells. There's a related class of tumors, of germ cell tumors, called non-germinomatous germ cell tumors, or NGGCT for short. These are germ cell tumors that have turned into some other kind of cells and are malignant. And that's quite a few different kinds of tumors there. So Megan had one of those, and it was a teratoma that had a malignant transformation. There are teratomas that are benign, and there are teratomas that are what are called immature teratomas that are considered malignant because they grow fast. And then there's teratoma that has a malignant transformation, like it grows slowly over the years, and then it turns malignant, and that's what Megan had. But these tumors are all treated by the same standard. It's a standard that's been developed over decades of learning to treat these tumors. I just can't imagine what people have gone through, as that knowledge was gained and as these treatments were developed. But thankfully, we are at a time now when we do have these treatments available, and they're quite good. And in Megan's case, of course, that chemotherapy treatment it worked. It did its job. We are so thankful for that. And I want to say that Megan has shown such bravery. She has never tried to get out of any of this. She's been trusted what the doctors have told her, and has trusted us as we help her get through these treatments. And she's never tried to get out of it. Even though they're tough, and she knew they would be tough, and as she had experience with these things, she knew that the next treatment would be tough. After one surgery, she knew the next surgery was going to be tough because the first one had been tough, the recovery. And she's just been so brave, just going into these things again and again and again, going through them, and then coming back and regaining her health, and being that happy, positive person, looking at the good in life and enjoying life, that person that just means so much to her family and to so many people. She's been a wonderful big sister, taken a lot of time to show love to her younger sisters. She's been able to do all the things that she loves doing, and that just means the world to us. When this all started, and we just didn't know what was going to happen, we didn't know what the future was going to look like. So now we can say the future looks good. It is good. We're in that future now, and it's good. And she is doing the things she loves to do. She is going on bird watching walks. She is going to game meetups with her friends. She is selling her crafts at markets. She's doing all those things. Again, she is volunteering. She's doing things. She's doing the things she loves to do. She's doing them with health. She's doing them with ability. And we are just so thankful for it. The Lord is just getting us through this. The Lord and so many wonderful, wonderful people are bringing us through this. We owe a lot to so many people. It's something we could just never pay back. It's, wouldn't even know where to begin. It's really something. I want to thank everyone who's watching this. Thank you for your concern for Megan. I am just so happy to be able to make this report on how Megan is doing. If by chance you or someone in your family is going through something like this and you would like to reach out, communicate about it, maybe share what you've been going through, maybe ask some more questions, please communicate with me through the comment section, and we can also get in touch by email, of course. And once again, thank you to everyone for your prayers and support. I'm continuing to pray every day. This has been my prayer. 1,000 miracles, only forward progress. No losing progress, no backward movement. That's my prayer. And from the very start of this, I've been praying that Megan would have 30 years of disease-free life. Now, when this started, I felt like I was asking for the moon. It seems much more attainable, down to earth right now, but I'm sticking with that prayer. I'm sticking with that prayer because that's what I told the Lord I wanted back when this started, and I'm sticking to this. And I'm just so thankful for the way things are going. All right, bye for now.